Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey, Public Health on Call listeners. You're invited to join us virtually on Wednesday, November 10th for the 2021 Bloomberg American Health Summit. This year's theme, Public Health Visible. You'll hear from great speakers and take in provocative discussions about major challenges facing health in the United States, including COVID, overdose, violence, climate, health problems facing immigrant children, and the broken food system. You can join the live stream at 9:30 a.m. Eastern Time on November 10th. Learn more at americanhealth.jhu.edu. That's americanhealth.jhu.edu. Today, Josh Sharfstein checks back in with Dr. Preeti Malani, the Chief Health Officer of the University of Michigan. They talk about how much better life is on campus this semester, thanks to the vaccine. Let's listen.
Dr. Preeti Malani, thank you so much for coming back to tell us how it's going at the University of Michigan this year.
Thanks for having me. It's really good to be back, and things are very good this year. And I'm glad to report that it is a big contrast to last year where, frankly, a lot of this just seemed impossible. And the biggest difference is, not a surprise, it's vaccination.
So let's go back to when we spoke, before. There were many things you were doing to try to reduce transmission. But even with all your best efforts, you were seeing outbreaks in the campus.
Yeah, I think our campus was similar to other large campuses. And many students last year chose to remain at their permanent residence or really not join us physically to be on campus. And the learning was mostly virtual. And even people living in the residence halls weren't necessarily interacting with people around the corner. And it was really just I think, a very difficult time, particularly for the more junior students who were new to campus. And this year is different, but it's not post-pandemic. And I think that's one of the interesting pieces is that talking a little bit about our campus. One of the things we decided to do pretty early on was require vaccination in the residence halls. That's a place we saw a lot of problems last year. In the sense that transmission occurred, especially among roommates and social groups. And we felt that was a place that we could keep safest with vaccine mandates. And then if you remember in the earlier summer, the feeling was really that vaccination protects you, you're not going to get COVID, and you're not going to spread COVID. And we decided not to really think about the entire campus. This was back in the spring. But as more information came out around Delta, and just that actually vaccines may not protect and that we were seeing breakthroughs, and we decided at that point to extend the requirements for vaccination to all faculty, staff, and students. And I'm proud to report that our students are about 96% plus fully vaccinated, as are our faculty. Our staff are a little bit lower. It's about 88% overall, a little bit different in different pockets, but campus overall is better than the surrounding community. And we're not going to see 0 cases of COVID, but can we proceed with the educational mission and not be disrupted? And that really was the goal.
So, going back to last year, if I showed up as a student at the University of Michigan, I would be pretty limited in where I could go and how many people I could be with, right?
Yeah, I would say that was unfortunately the case. And I think it was different for living off campus than it was those living in the residence halls. And, frankly, by the middle of the semester in the fall, a lot of the students went home because this was difficult.
Right. The restrictions were so severe at that point.
Yeah, it wasn't fun to be on campus for a lot of people. And frankly, the anxiety of being on campus. And we've learned a lot about COVID since that time. And certainly there were many cases among our students and students all over. And for that matter, K-12 was a bit protected because people weren't in face-to-face learning. But we got through and people continued their education and the retention rate was really good. But it was not ideal. We really wanted to get back to something that looked much more typical. And, I will say that it looks pretty typical, especially in the social settings, but classrooms continue to have some limitations, and particularly masks are required. And I think if you don't have that in indoor crowded settings, and I would include classrooms in that group, it's very difficult to do this.
So if I were to be a student at the University of Michigan now, I would be vaccinated and I would be wearing masks in class. But what are the other key elements of life now?
So as you know, Josh, the approach to this is always going to be layered, and there are a number of things happening. So vaccination is definitely the backbone for us. And we have learned that it is working. And I think in these young, healthy, primarily young and healthy, very healthy immune systems, people have good protection. And what we're not seeing is spread to roommates and social contacts. And that, in fact, at one point, the cases, we were down to like 8 cases in the residence halls a few weeks ago. And there are still cases. They're primarily breakthrough, quote unquote, cases, and primarily mild, although there have been a few students who have certainly had symptoms. This year in the residence halls, because in the residence halls we're at like 99%, masks are optional in those settings because it is like your home. And we wanted to really balance those risks because there's a huge risk to not connecting with your community and not feeling like I can leave my room, that I can go down the hall and like be a normal college student and like laugh and play and interact with people. I will say that if you walk around campus, it looks like a pretty typical year. You'll see a few people wearing masks outside, but overall, you see joy, you see crowds, you see a lot of people still getting together outside. And I think in the residence halls, the experience is much better. Last year, in talking to some of the students who were there, you're pretty much in your room doing virtual school. And by second semester, we pretty much said, don't come here unless you have to. And people had to apply to be on campus. Like they had to have a unique circumstance.
Right. So it is really night and day thanks to the vaccine.
Oh, absolutely.
I want to ask you about mental health, because right from the beginning, you were talking about that. When we were talking in those early days of what we were going to do, you said that you were really worried. And it sounds like, there was reason for worry and a lot of kids went home. And how's your thinking on that evolved through the pandemic?
Yeah. So as you know, and you're, a pediatrician and a parent by background, so, we talk about this, we talk about, sort of our college students and how complicated the world is for them even before the pandemic. And, the fact that people ended up isolated and ended up lonely and, on top of already having those issues, those predate COVID, the mental health piece is very, very much on my mind. And, I say it all the time is, COVID is not the only risk to our health. We cannot only think about COVID. And frankly, we can vaccinate people against COVID. I can't vaccinate them against loneliness and depression and anxiety. And I can't vaccinate them against poor academic performance, which is another risk. And sometimes they go hand in hand, frankly. I will say that being back to something that feels like normal, and for our incoming students, they haven't really had a normal year since they were sophomores in high school, right? Their junior year got disrupted. A lot of them spent their entire senior year remote. And frankly, I think academically, they're coming in with challenges. So, certainly, being together with people helps a lot of them. It doesn't make everything go away, but we are seeing fewer people who are having a lot of distress. But at the same time, there's this grief and loss from the past year and a half that a lot of people are trying to work through also. And it's interesting on campus is that we have 2 classes of incoming students in many ways. And we've really focused a lot of energy on the second year students. Some of them didn't spend any time on our campus, but really thinking about their well-being especially if they're moving off campus and they don't have like that core group of folks that they are connected to.
I want to ask one final question, which is, let's envision the University of Michigan campus 5 years from now. And let's assume that the immediate threat from the pandemic has really receded. Let's just hope that that's truly happened. But I wonder whether campus then looks exactly like it did in 2019, or are there things that you've learned from the pandemic, either about infectious disease transmission or mental health or something else, that might be something that makes the campus look different, in the future?
Yeah, I'm glad you asked that. I have to say, I'm like a glass half full type person, as you know, and I think one of the potential silver linings in all this is that people who normally never spoke to each other, and I'm talking about administratively, are working together every day, all day. And I'm hoping that same energy that's been put into figuring out how to test people and how to vaccinate people and how to, do surveillance and contact tracing can be now parlayed into health more broadly. And, again, for young people and for our students, but also for our faculty and staff, I think it is thinking about community and discussions and support and trying to help identify folks in distress and trying to really make a campus that's inclusive and kind and really can help support everyone to be successful. So what I would say is 5 years from now, COVID won't necessarily be completely in the rearview mirror, but I think we are marching toward endemicity where it's here. Some people will, get infected and they will have symptoms, and whether we're going to, boost our way out of this, I think is a big question. I am hoping that more people will get first doses who haven't, but I think it's not going to be so disrupted around this. There'll be some ebbs and flows with this, but I hope that some of the resources and the creativity around use of these things, whether it's virtual, whether it's peer to peer, whether it's doing things outside and in groups, will continue. My hope is that some of the young people who have lost part of their years due to this awful pandemic will double down and really engage in a really meaningful way. And I hope our community will be stronger.
Well, Dr. Malani, thank you so much for that vision, for all the work you've done, and for joining me today.
Thanks for having me. And thanks for doing these podcasts. I love listening to them.
Public Health On Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.